us a case of posterior medial meniscus root tear. As you can see on the axial images on the MRI, there is a ghost sign on the sagittal images of the MR, and you can see the posterior root tear there on the coronal images as well. This is how it looks on the arthroscopic view of a degenerative posterior medial meniscus root tear. This patient also had medial compartmental osteoarthritis with some cartilage changes on the femoral condyle and tibial condyle as well. So this is how we, on the diagnostic arthroscopy, we probed and we found out the posterior medial meniscus root tear. So to start with, we do for the repair, we start doing the curating and preparing the bed for the repair with a ring curate or with a tooth curate. We need to remove the cartilage from the root area, and there should be a bleeding bone for enough of the bone marrow to come in and allow healing. So we need to slowly gently remove the cartilage and may prepare the trough. So here we are removing a sliver of the bone to make a place for the proper healing of the meniscus root to the bone there. So we take the knee scorpion and try and take hold of the root to see with its reducibility to the place, to the anatomical position. And then we start taking bites with the suture tape. We'll be doing a single tunnel double stitch root repair. So we're going with the first knot, which would be a cinch knot, and a simple along with it. And then we'll go for our second one, which would be a simple cinch knot. So we pull on the meniscus to see it is taut and the bites are through and it is not getting cut through. So this is how the cinch knot looks like. Now we'll be preparing the bone tunnel through a jig, and we'll pass a suture shuttle for passing the suture tape down through the tunnel outside over the tibia, where we would tie it over a dog button or a suture disc or an endo button. So we pull all the wires through suture tape through of both the knots through the tunnel, and here you can see the reduction of the meniscus. The meniscus is already fallen back in between the condyles, and it is covering a good part of the tibia now. This will go a long way in preventing the further cartilage degeneration of the patient. This is how it looks finally after the surgery.